ahead on Pathways.
You feel like they're a part of your family. Like I've had some patients I am so attached to, and then when they have passed on, I feel like I've lost like a grandparent, because you learn to know their family, and it's not just John Doe or Jane Doe sitting next to you. Like they're a person, and you actually get to know them in this field.
Medical assistants are the link between patient and physician, offering a friendly face to those who need it and detailed information to help doctors diagnose.
Welcome back to Season 2 of Pathways, part of Northern Light Health's Healthy, Happy, and Wise podcast series. I'm your host, Emily Tadlock. This season, we are focused on healthcare careers that take you about 2 years or less of learning to get into. So this episode is going to focus on medical assisting. And I'm joined today by Madeleine Dow and Zandra Maclean, two medical assistants at Northern Light Blue Hill Hospital. Hi, ladies.
Hello.
Thanks so much for being on with me today.
Thank you for having us.
Yeah.
Yes, absolutely.
Okay, so let's first of all kind of get to know you both a little bit, because you both have different experience. Zandra, why don't we start off with you? Tell me, how long have you been a medical assistant and what got you into it?
Well, I've been a medical assistant for just over 4 years, and I had originally planned on going to nursing school.
Okay.
And then life just happened, and I could not make the commute back and forth from down east at the time to Bangor. So I got into an online program for medical assistant, and did my 2-year associates, and everything was online because COVID was happening, so I couldn't go places.
Oh,
so
okay, yeah.
that was great, getting the dummy arm and, you're having to draw blood out of it. So
It's always fun.
yeah, and then and as far as the medical aspect, I always, have had a thing for medical. Even in the military, I wasn't, a corpsman or anything, but I still did, had my hands in, with that piece of it. So this is just fitting for me.
Okay. And you were in the military before this?
Yes.
What did you do?
20 years in the Coast Guard.
Wow, 20 years. Mm-hmm. Wow.
So this is my second career.
Okay, that's awesome. How interesting.
Yes.
So Zandra's on her second career, 4 years in as a medical assistant, whereas Madeleine, you are brand new to the profession.
Brand spanking new.
It's our baby MA.
Yes, the baby.
So Madeleine, tell me, but this isn't your first experience with healthcare either. So tell me a little bit about your journey here.
Yeah, so when I was in high school, I actually took a CNA program at the Hancock Community. It was like a tech school.
Okay.
So I went to high school half the day, and then I went to the CNA program, and I got my CNA and my CRMA, and I worked at a nursing home for about 4 years. And then in 2018, I decided that I wanted to take a break. I got a little burnt out. We were low staff. And I was working very long hours. So I took a break from healthcare, went to the Jackson lab, and I worked there for 4 years.
Okay.
Convenient time to take a break from healthcare because of 2020 and COVID.
Right.
So I didn't have to go through that. But after being at the lab, I missed healthcare and wanted to go back. So I went to radiology school. And I was in radiology school for 1.5 years. And found out that was not for me. I was trying out different fields. And then I applied for this program, the Earn to Learn Medical Assistant program.
Okay.
And that was 6 months. And as Zandra said, some programs are 2 years and some are 6 months. This was a hybrid course.
Okay.
So I did my labs in person and did my classes on Zoom. And I went to the Sullivan Education Program, the adult education in Sullivan for my labs. So,
wow. And look at that. Boom, you're a medical assistant.
Yes, I just took my test on the 10th and passed first try. So
awesome.
I was proud about that.
Yeah, you should be, as you should be.
So I'm fresh and new.
Yeah, just like a couple of weeks in.
Yes.
Okay. So tell me a little bit about you. You said you tried out some different careers.
Yes.
Why did you feel like medical assistant was kind of where you wanted to be?
I love the one-on-one interaction with my patients. I loved radiology, but you're very busy. You're running the entire day. You're seeing a lot of people. I like to sit down with my patients, talk to them, see how they're doing. A more one-on-one, bigger connection with my patient is what I was looking for.
Okay.
And with medical assistant, I found that I'm talking to many patients a day, having one-on-one conversations, learning about their life, and I'm really enjoying it.
Oh, awesome. Okay. So
Yes.
before we go much further, because we have some listeners on here who may not know what a medical assistant is. So Zandra, why don't you explain exactly what a medical assistant is and what they do?
Well, I think every place you're at is a little bit different as far as what the actual MA would do.
Okay.
Like in primary care here, we have our hands in everything. We
Okay.
room in the patients, getting all the vitals, med reconciliation. We give immunizations. We draw blood. We do EKGs. Lots of phone calls, med refills, prior authorizations for different things, putting in orders for whatever they need to do. It's kind of like primary care is the hub for everything, because you can't go somewhere unless you have that referral.
Right.
And who's the one who puts the referral in? Usually the medical assistant.
Okay.
And we are busy from time we get here till the time we go home. It doesn't stop. But there are other offices, specialties where they just are strictly, they might just get, like, say, their vitals and help cast and things like orthopedics or something.
Okay.
But for us in primary care, we literally have our hands in everything.
Okay. So you're also the link basically between patient and physician,
Yes.
correct?
Yes.
Okay. So you, especially somewhere like Northern Light Blue Hill Hospital, which
Yes.
is a small rural hospital, you know your patients pretty well.
Absolutely. And they become like a member of you feel like they're a part of your family. Like, I've had some patients I am so attached to, and then when they have passed on, I feel like I've lost like a grandparent, because they're so, like, you learn to know them, and then when you see their health declining, and it really hits you, because it's like, wow, and you learn to know their family, and
Right.
it's just like, it's not just a John Doe or a Jane Doe sitting next to you. Like, they're a person, and you get to know them in this field, which I love. And even patients who come in and they may be having the worst day out there, and you talk to them, and yes, and they are frustrated for whatever reason. They might not be feeling good, but we are still the go-to. And usually when they, when I walk out of the room, they're better, as far as like, they're not all amped up, and then you talk to the provider, hey, this is what's going on, so they know, you kind of that relay.
So it's not just about, the technical medical things. It's really about care and giving care.
Absolutely. And that's the thing, is like, sometimes you have to just stop everything that you're doing and like look at them, as a person. Like, I'm not just sitting here typing in a computer. Like, I'm going to talk to you. And like, if something doesn't seem right with them, like, seems like they're short of breath, whatever it is, like, you can initiate the things, like, you run by the provider. Hey, they're, seem like they're low on oxygen. Yes, they are. Or it could be they need an EKG. They need to go immediately to the hospital. So it's not, just, red and, black and white. Like, this is how we do it. It's
Right.
not like that. It's a whole different field here.
It sounds exciting.
Yes.
So, and you're not only in a patient exam room, you're also on the telephone.
Oh, yes.
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 We do a lot of telehealth.
Okay. So tell me a little bit
Yes.
about that, Madeleine.
So the telehealth, I believe, became implemented when COVID became a thing, and a lot of people couldn't come in because they were sick, didn't want to get exposed. So we do telehealth, where you can meet with your provider over video. We get the patient ready over video, just like if you were coming into the office.
Okay.
We go over meds, go over allergies, the same things you do here. And then the doctor will come on. Just like in the office, the doctor will come in after the medical assistant. And it's great for a lot of patients that can't get out of the house, don't have transportation, but still want to meet with their doctor and tell them their concerns. So I think it's wonderful.
That's awesome. Yeah. Well, I mean, it's great for those folks who can't necessarily get out and get into the office. Tell me a little bit about, obviously you're the link.
Yes.
You're the person that has to call with whatever news or call. You're the one that they talk to when they need a refill or whatever. People are not always happy. They're not always having the best day.
No, they are not.
So what is that like?
And I 100%, some days it is very draining and it is taxing. And at the end of the day, when you've dealt with more negative, because when we call to do results, a lot of times it's just basic. Right. But then there's times when there's stuff and then they start asking you questions. Well, we're not authorized to give out medical advice that way.
Right.
So then you have to get back to the provider and then call them back. And sometimes the providers can't answer immediately. So then the patient gets frustrated. They don't understand. Well, why isn't it now? Why can't I, have the answer right now?
Right.
And you try to explain it. But, for all the ones that might give us a hard time, there's always the ones who are just a delight to talk to. And I would talk to them all day. And you just call and you hear them. Like this morning, I called a 93-year-old woman and just to see how she was doing. And because I knew last week she was having an issue, I was just checking in on her. Yeah. I didn't have to. That wasn't in my job profile to call her. But I just want to see how her shoulder was. Called her. She said, I am so much better. Thank you for checking in. I don't need to overmix the chocolate chip batter dough again. Okay, because that was what caused it. So it's those things like you learn. So, but yeah, as far as phone calls go, and we will honestly, there's some of us, and we will pass it around like, can you please call this patient because they've talked to me 5 times today and they don't want to talk to me again. They want
want someone new.
Another voice gets on and then they're like, oh, okay, thank you, because it's now they
feel like it's moving, something's being done.
Absolutely.
Right.
And that's what, as a team here in general, I mean, we all look out for each other. And we're always on each other's desktops looking to see calls, whatever needs to be done, because it's a team. And, I work with one of the busiest providers here. So my desktop sometimes will just be overloaded with results and, calls from patients and things like that I have to do. And that's where, as a team, everyone hops on, if they're not seeing patients, So as far as like here, we are a great team and we work very well together, I think.
Well, I love that. And so, Madeleine, that also goes back with, you're, as Zandra said, you're our baby.
Yes,
you're
I'm
our brand new MA. So what is that like, coming in and being part of this team and, you're fresh, you're new.
Yeah.
You may be a little nervous.
Yeah, it was a little nerve-wracking. When I first started this program, I was working over at the Castine Primary Care.
Okay.
And I was technically a PSR, but because of my medical experience, they had me pretty much working as an MA. So I was working as an MA almost for like 6 months. So before I even came over here, I was very comfortable with what I was doing.
Okay.
That's why I really advocate for the earn to learn. I'm a hands-on learner.
Okay.
I don't know if you guys out there, if there's anyone that's a hands-on learner, but I learned best hands-on, and I would learn something on a slideshow. I will not retain that information. I could try all day. It won't work. So we'd learn something in class and I could practice it at work the next day. So that's what I really loved about it, the hands-on. And it made me not as nervous. And when I came over here, I love how everybody works together. Everybody's been wonderful, welcoming. I have nothing bad to say about this office. So
I love it.
Yeah, it's been great.
Well, that's encouraging for anyone who is, teetering on whether they'd like to look at medical assisting as a career, to know that it is a team environment. So you wouldn't be alone. So if you work best alone, may not be the best career choice for you.
And if you need to be a multitasker. If you are not a multitasker, like it's probably not a good fit. We've had people who have been here and primary care just isn't their thing as a medical assistant, but they can go to a specialty clinic where they're focused on one particular thing, and it's totally different. Whereas here, it's birth to death pretty much, and everything in between, and no two patients the same, versus like something else. It's literally the same thing over and over. Yeah.
Okay. So while medical assisting is medical assisting, it is still very different.
Absolutely.
Depending on where you're at.
Right. Because in some, we don't do it here, but some medical assistants actually do the billing and coding piece of it. And that was one I said, I absolutely want nothing to do with that. Keep my hands way away from it. I don't want to do coding. I don't want to do any of it.
It was not my favorite either.
I was like, hard pass, no.
But
when I had to take that class,
know a little bit of
no.
it, but yeah.
So, and I think cancer care in Brewer and possibly even here, the MAs there also do different things too, right?
Yes, at Cancer Care, they do, they assist with like the bone marrow biopsies, and they're accessing the ports. And that is super exciting to me because I love having my hands in doing things like that. But here we do get to, we help a lot different providers with, they're doing procedures, whatever it is. But we're in there, we're taking out the staples, we're taking out the sutures, literally helping with wound care, like in whatever we need to do, that's where we go. And, no two patients are the same. So literally some days it's like EKG day and we're all like waiting for the EKG machine. Can I have it? Me next,
You never know what's going to happen in your day. And that's what I like. And
the variety.
Yeah. And that's why I chose this career. I get bored and doing the same thing every day. So even if I get bored in primary care, I can always go to dermatology. I could go to women's health. A lot of people in my class, we all chose different areas. Like I'm in primary care. And another girl in our class, Jalen, she's in cancer care, in like the infusion center at Main Coast, at Mary Dow. Hannah's in women's health. I believe Lacey's in women's health. Desiree's in peds. Like we're all over the place. You can go in any area. And if you don't like a certain area or you've been there a long time and want to try something else, you can go to a different specialty. And there's always something new to learn, which I love.
Well, that's really neat. That's a cool aspect of the job there.
Yeah, there's another piece to that is like, I think medical assistant honestly is like a good stepping stone, because we've had several MAs since I've been here who they came here, they got their feet in, they learned a lot, and they said, I'm ready to go be a nurse now. So they went and they breezed through school easier than had they, not had any experience at all, because now they know the medical terminology piece of it. They know, a lot of things. They already know how to do injections, so I think that's really good. And we have like one MA here right now, and he's getting ready to, pursue the RN program. And we just had another one. She just graduated from RN. And so it is exciting to see them grow like that. And I said, someday maybe I'll go that way. But right now I'm content doing what I do.
It's a career that you could either stay in forever and love, or you could use it as a chance to propel yourself into something different and farther along. So that's pretty cool.
Yes.
So, we're talking a lot about what medical assistants do and things like that. And we talked a little bit about the Earn While You Learn program. But can you explain, Madeleine, to our listeners how that program works and what the learning is like?
So my mom sent me a link. She found it on Facebook. Northern Light was advertising for the Earn to Learn program. And so I actually applied to Northern Light first. Had an interview, and they're like, okay. And they accepted me, and then I had to contact the adult education and do an interview with them. And then once I got accepted there is when the Earn to Learn program started in May. And then I just finished in December, end of December. And took my test in January. So it's very quick. You're learning a lot at once. It helped that I had a lot of medical experience, and I've taken a lot of anatomy classes in the past. So that helped a lot. So it is quicker. Some people like to do the 2-year program and get their associates as well. but I liked the quicker pace because of my experience.
Okay.
So I applied to Northern Light first, and then you had to apply to the adult education. In my class, we had 3 separate adult educations that came together. Like mine was Sullivan. A lot of the other girls were from Bucksport, and then we had Baileyville.
Okay.
We all came together for Zoom classes, and then did our separate labs at the adult education.
Okay. And it was Earn While You Learn. So you were also working for Northern
Yes.
Light Health.
Yes.
You know, technically working part-time, but being paid full-time and maintaining benefits too the whole time, correct?
Yeah, so you get benefits. We did have to make a commitment, and we also got paid while we were in class. So that was very helpful. I don't know if anyone has ever worked a full-time job and tried to do school at the same time. It's very difficult. I've tried to do it in the past. But having part-time but also getting paid full-time was very helpful. And I didn't feel like I was overwhelmed.
So you're
with
basically
work.
being set up to be successful.
Yes, exactly.
I think that's super important for anybody out there who's looking at getting into healthcare as a career.
Yeah.
And Zandra, even you mentioned it as a second career, you know, you may have been doing something else your entire life and then decide, you know, I've always wanted to give it a go, and this could be the type of program for you.
Oh, yeah, absolutely. And I chose to do my 2-year associates just honestly so that I had a lot of the prereqs done for nursing school and
Right.
everything, because it's our, you know, those are all required. And I knew myself, and at the time, you know, COVID was going on and it was going to take, you know, a little, so I said, well,
Yep.
might as well do that. And then when it came time to do my clinical hours, no place around is taking any students because COVID. So thankfully here, like, you know, my university worked with Maine Coast to get me here. And then 2 days in, I was like, they're like, hey, you going to apply for a job here? You going to apply? You're going to apply? And finally I was like, I think I was like close to it. I was like, fine, I applied. Like I knew I was going to anyways, but I just like to keep them hanging.
Well, when I
your options
think when they see a good worker, someone who's going to do great and
Yeah.
works well with patients, they're like, yeah, we need you. They just want to lock you in. I like it.
Yes, and I have thoroughly enjoyed my time here, and I said I love, you know, I get more responsibility, and I train a lot of. I didn't have to train her so much, but a lot of the new MAs coming in, I'm the one who trains them here.
Okay.
You know,
She's
we all do,
amazing.
but because in the military, I trained so many people. So
Right.
and everyone has a different learning style. So I can kind of just go to that. Like I personally, I'm a hands-on. So I love it when I'll now throw them right in. They're like, let's go hands-on. This is the only way you're going to know it. So
If I don't do it with my hands, I will not learn.
right. It's repetitiveness. Like
Yes.
even doing charting, you know, all that with the computer, just click, 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 you know, but it becomes second nature. It's just, as they say, you can sit there and watch me all day long doing it, but until you actually do
it yourself.
you're not
And
gonna.
she's a wonderful teacher.
Aw. You know, and that's awesome to hear. You know, it's encouraging to hear as we're looking to hire more medical assistants across our system that we have people like you, Zandra, who are wonderful mentors to our new ones like Madeleine, and bringing them along and making them feel welcome and happy to come to work, because it seems like you're both happy to come to work.
Oh
very
yeah,
happy.
absolutely. I'm usually the one, like, I'm here early. I like leave late, you know, like just because I want to make sure everything is done. I hate having anything not finished at the end of the day.
Yeah.
And, you know, as an MA, I mean, there's so much responsibility that goes into it. And when like your provider dumps at the end of the day, like, here's all your results. And I'm like, oh, okay. So I don't feel right letting them just sit there. So I'll sit there and make phone calls until everyone has been addressed, or at least a call, you know, has been made, because that's just.
Yeah, and even when you have an empty inbox, you go and check other people's inboxes. There's always someone helping you out. And I love that, like, all the MAs are great resources as well. If you don't know an answer to a question, you have so many people to ask to
Yes.
help you. And it makes me feel so comfortable working here because no one judges me for a question I ask or anything. So it just makes me feel comfortable.
You're all just trying to do your best by your patients and
Exactly.
and then enjoy working together.
Absolutely.
Yes.
They said, and it's family medicine, and we are, primary care, whatever you want to call it, but we are still like a family here. And, and that's the thing is like, if somebody like sick, whatever, somebody else can hop right in and take over. And that's the thing is we're trained. Everyone knows exactly what they need to do, so there is no question. Granted, every provider is different to room for. Some don't want to hear anything. Others, they want like the full list of this is exactly.
I've noticed that. Yes.
Yes, and exactly. Like there's some literally
career.
like, hey, your patient, and they just look like, okay, all right, I'm not going to go any further, but they're ready for you. Instead of like my provider, I give a full rundown, everything, vitals, the whole everything, and okay, great, goes on in. But there's others, so you learn the providers and what they expect, and and
What they like, and
yeah.
Wow, there's so much that goes into being a medical assistant that I had no clue about.
Yeah, there is. Yes. They say, come to family medicine. They said, it's fun. They said, and I'm always like, yeah, you guys. When 4 years later, here I am still.
Yeah. When they first put me in primary care, I'm like, I don't know, guys. I don't know if I'm going to like this, but I ended up loving it and I don't want to leave.
Yeah, well, there it is. Yep.
So.
That's awesome. Thank you so much, ladies,
Yes,
for
thank
taking
you
some
for
time
having
out.
us.
Yeah, thank you.
Just one more question to both of you. If you had if you had one thing to say to encourage someone to become a medical assistant and get into this field, what would you say?
I would say if you are a people person and you love communicating and working with other people, and I think primary care is the place for you, and being a medical assistant is very rewarding, and I would suggest it to anyone.
Yeah, see, she's the people. I like just being in my little room with the patient, just chit chat. I don't like big crowds. But for me, what I could put out there is basically just explore what you want to do, and this is a great stepping stone to further boost where you want to go, what you want to do. And I said sometimes you might just want to stay right in your specialty. Others, it does boost you up. You can go be a nurse. You can go do whatever you want to do, but this is a great starting point. And I think, you get your hands in it and you should love it, but not everyone does.
Well, I can tell that you both do love it,
Yes.
and that's awesome. So thank you so much for sharing your stories with
thank you.
me.
Thank you.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.